Hello guys, welcome back to our YouTube channel, that is Homoeopathic Trials. Today, after a long time, we are going to learn a very important topic of Organon, which is important both from exam and practice point of view, which is classification of diseases. But before beginning, guys, do not forget to like, share and subscribe to our channel and hit the bell icon to get notified about our content. So without wasting much more time, let's begin. So before understanding the classification of diseases according to our Organon, first let's try and understand what is a disease. Now disease is defined as the derangement of the vital force from the state of health which is expressed outwardly in the form of signs and symptoms. So now that we know what exactly is a disease, now let's try to have a look at the classification of diseases according to the concept of our Organon of medicine. So diseases are firstly divided into three categories. The first is indispositions, second is surgical diseases, and third is dynamic diseases. So now let's understand all these three types of diseases in detail. Now indispositions are nothing but slight alterations from the state of health where the patient expresses very few trivial or unimportant symptoms. So indispositions are not very severe diseases and are caused by some changes in diet and regimen, and thus they are also treated with correct changes in the diet and regimen. For example, in a case of stomach upset or indigestion caused by overeating, fasting or light diet is sufficient to restore your health. The next important type of diseases is surgical diseases. Now surgical diseases are the injuries which are caused to the body from outside, for example accidents or poisonings, etc. As the name suggests, surgery is the only option to remove the external obstacles to cure. Now after that we have dynamic diseases. Now dynamic diseases are nothing but the derangement of the vital force caused by some internal or external cause. Now this category broadly covers the majority of diseases and are also further divided into many smaller categories which we are going to discuss further in this video. So dynamic diseases are broadly divided into two categories: acute and chronic diseases. Acute diseases have following characteristics. These are rapid morbid processes of the deranged vital force. They have a perceptible and easily seen onset, complete their course in fixed and short period of time, and it can either end into cure or death. While chronic diseases have following characteristics. They have a slow, ongoing process of the derangement of the vital force. They usually have a slow, imperceptible onset, and it can cause gradual and continuous derangement of the vital force. These diseases usually originate from some or the other chronic miasm. So now that we have seen what are acute and what are chronic diseases, let's try and understand their further classification in detail. So first, let's have a look at the classification of acute diseases. Acute diseases are broadly divided into three categories: individual acute diseases, sporadic acute diseases, and epidemic acute diseases. Now individual acute diseases are these diseases which affects single person at a time individually. These individual acute diseases are actually caused by some exciting cause or some immediate cause. For example, overeating, sudden changes in temperature, sudden strong mental emotions or physical strains, etc. Sporadic acute diseases are those type of acute diseases which affect several people at same time but at different places. Now these type of acute diseases are usually caused by some meteoric, that is some environmental or telluric causes. For example, change of seasons, etc. The next is epidemic acute diseases. Epidemic acute diseases are these types of acute diseases which affect several people at same time at same place, and usually the cause too remains the same. These diseases may be contagious when they occur in a densely populated area. In these type of diseases, patient usually presents with similar identical symptoms, and thus on seeing few good number of cases of an epidemic, the homeopath can also reach up to a genus epidemicus which can help to further prevent the cases of that particular epidemic. For example, recent example of an epidemic is the COVID pandemic, where after seeing few cases, arsenic alb was declared as the genus epidemicus. Now, after seeing acute diseases, let's have a look at the classification of chronic diseases. Now chronic diseases are divided as seen below. The first important division is between fully developed symptoms and chronic diseases with few symptoms. Now chronic diseases with fully developed symptoms are further divided into non-miasmatic and miasmatic. The miasmatic diseases are further divided into psora, psychosis and syphilis, while the non-miasmatic are further divided into artificial chronic and inappropriately termed chronic, that is pseudo-chronic diseases, while the chronic diseases with few symptoms are further divided into one-sided diseases and local diseases. Now, one-sided diseases are further divided into diseases with mental symptoms and diseases with physical symptoms. In this video, we will discuss only chronic diseases with the fully developed symptoms, as one-sided disease and local diseases are a separate video topics and will be discussed later in our future videos. Now, chronic diseases with fully developed symptoms are basically of three types. The first is miasmatic. Now, those which arise from some particular miasm, either sora, syphilis or psychosis, are called as miasmatic diseases or are also termed as true natural chronic diseases. The next important is artificial chronic diseases. Artificial chronic diseases are those type of chronic diseases which are caused by prolonged use of allopathic medicines in large and increasing doses. According to our master Hahnemann, it is very difficult to treat these type of diseases because it becomes very difficult to get the original picture of the diseases, and thus it becomes very difficult to find the correct remedy, and thus they are almost incurable. The next important type of chronic diseases are pseudo-chronic or inappropriately termed chronic diseases. These are those type of chronic diseases which are caused because of some continuous and ongoing faults in a person's diet, regimen or in living conditions. If suppose a person smokes daily or consumes alcohol daily and then falls ill, then such diseases are termed as pseudo-chronic diseases, because if the person avoids these noxious influences, then he usually recovers very easily. So guys, this was all about the classification of disease. We hope this video helps you all, and if you guys have liked this video, please do like, share and subscribe to our channel and hit the bell icon to get notified about our content.